Yeah. Okay. Great. All right. I'd like to call our PIES meeting to order today. We don't have any requests to talk about consent items. We're going to go a little bit out of order. We're going to start with fluoride, and then after that, we're going to go to the Highway 195 corridor discussion. So we have visitors on both matters. And on fluoride, council requested that we get some further technical information about funding and how this might work. And I'm not sure the exact person who's going first on that. So if you can unmute yourself. And maybe Emily, are you coordinating people? I don't know.
Emily, you're on mute. Do you want me to start? Maybe I'll go ahead and kick it off.
Yeah, that's great. Go ahead and introduce yourself.
All right. Yes, I'll do that. Hi. So I'm hearing an echo. Is that me or is that the... I'll just kind of carry through. All right. My name is Vanette Abdulatif, and thank you for welcoming me today. I'm the new president and CEO for our Cora Foundation, and I'm really glad to be here. And new to Washington, I just moved here in February. So I hope to get out there and meet folks in person sometime soon. So I want to start off by thanking the council members and Director Simmons for all and everyone else who was involved in organizing today's meeting. I want to really thank you for your leadership on this really important public health issue. I'd like to start with a little background on our Cora for level set for everyone. The foundation has worked closely with Spokane and communities across Washington for the last 20 years to prevent oral disease, expanding access to care, and integrating oral health into overall health. We're committed to raising awareness that oral health is essential to overall health, and that oral disease is nearly 100% preventable. Delta Dental of Washington, with offices in Spokane and Colville, funds our work, and Delta Dental is also a nonprofit like our Cora, and together we share a vision to improve oral health and overall health for all, with no one left behind. We're focused on improving health in communities across the state. For example, in just the last few months, the Cora Foundation has provided more than $4 million in grants to community health centers, nonprofit dental clinics, and tribal dental clinics to help them respond and to manage COVID-19. And our Cora is continuing to be committed in the oral health space. We are willing to provide up to $3 million, or 75% of the overall capital needs to implement fluoridation in the Spokane community. We also will also administer a contract for local dollars that are raised toward the additional 25%, or $1 million needed to close the gap of the total cost of $4 million. You know, COVID-19 has put a spotlight on America's fragile public health system, as well as the numerous disparities that disproportionately affect people with lower incomes, people of color, people with disabilities, young people, and our elders. For those who are already experiencing pain caused by tooth decay, consuming fluoridated water may stop the progression of decay and the complications associated with oral health disease. Sadly, the pandemic has exacerbated these conditions. And for the most vulnerable populations, as well as forced closures of dental clinics that would have provided access to dental care. At our Cora, with our focus on disease prevention and access to vital services, we see disparities in oral health and overall health as an important public issue that we want to make sure is addressed. Community water fluoridation is one of the most effective, low-cost, and equitable ways to prevent oral disease without regard to race, ethnicity, age, or income. Everyone benefits from fluoride. It will provide the health, it will improve the health of Spokaneites today and for generations to come. Spokane has a long history of innovation in oral health care. Programs started here, including access to baby and child dentistry, the ABCD program, have been adopted in every county in the state and serve as a model for the rest of the for the rest of the country. This legacy also includes Smile Spokane, a network of local organizations working to improve oral health. Yet it will be difficult to make further strides to improve oral health without the benefits of community water fluoridation. I encourage you to pass this ordinance for the health of everyone in Spokane, because oral health is vital to overall health. I'd like to now introduce you to Torney Smith, who's a member of Smile Spokane and former administrator of the Spokane Regional Health District. Torney?
Thank you, Vanetta. President Biggs and council members, thank you for the opportunity to speak to you today. As it was just mentioned, I am the recently retired administrator of the Spokane Regional Health District. I continue to work with and support Smile Spokane. A brief background for Smile Spokane began in 2015 with a group of concerned individuals and organizations, which included philanthropy, public health, social service providers, dental professionals, and higher education, who convened in Spokane to identify ways to address the community's serious oral health problems, including the lack of a good balance of fluoride in the water. This group dedicated themselves to developing a comprehensive set of strategies that could significantly improve the community's oral health. Smile Spokane was created with the financial and programmatic support of the Arcora Foundation. In 2017, Smile Spokane evolved to become a local impact network, or a LIN, linking committed community partners together to improve oral health. There are multiple organizational partners in the LIN, and the work is organized into 7 anchor strategies that span prevention, access to care, and system transformation. Smile Spokane has been joined by a coalition of partners in supporting community water fluoridation. The coalition includes healthcare systems, higher education institutions, payers, dentists, physicians, federally qualified health centers, nonprofits, and foundations. The following are partners who have signed on in support of community water fluoridation. And it's a long list, but it's important you hear all of these members. MultiCare Health Systems, Providence Healthcare, Providence Medical Group, Chaz Health, Kaiser Permanente, Spokane County Medical Society, Spokane District Dental Society, WSU College of Medicine, the University of Washington School of Medicine, Eastern Washington University Department of Dental Hygiene, Washington Association for Community Health, Community Health Worker Coalition for Migrants and Refugees, Spokane's NAACP Branch 1137, the Carl Maxey Center, Latinos in Spokane, I Did the Time, Asia Pacific Cultural Center, Latino Community Fund of Washington State, Spokane Public Schools Board of Directors, Spokane Public Schools Foundation, School Nurse Organization of Washington, the Washington State Association of Head Start and ECAP, Children's Alliance, Communities and Schools of Spokane County, Tooth Savers of Washington, Spokane Housing Authority, Spokane Low Income Housing Consortium, Statewide Poverty Action Network, Spokane Treatment and Recovery Services, Smile Spokane, Better Health Together, Empire Health Foundation Community Advocacy Fund, the Health Sciences Student Advocacy Association, Greater Spokane Progress, Leadership Spokane, League of Education Voters, Priority Spokane, Spectrum Center Spokane, Volunteers of America, More Equitable Democracy, the Arcora Foundation, Washington Dental Hygienist Association, the Washington State Dental Association, Community Health Plan of Washington, Coordinated Care, Delta Dental of Washington, Molina Healthcare of Washington, Primera Blue Cross, 5 Mile Smiles, Chafin Dental Care, David Engine, Doctor of Dentistry, Dental Care of Spokane, Dr. Scott Ralph Orthodontics, Integrated Dental Arts, Johnson Dental, Kids Smile Dental, Lilac City Dental, Northview Family Dental, Perio Central, Reamer Family Dentistry, Smiles of Spokane, South Hill Comprehensive Dentistry, Spokane Oral Surgery, Spokane Pediatrics, Velas Family Dental Care, Wilbur Family Dentistry, and Wilder Dentistry. So funding for this endeavor is planned to cover all of the capital costs. The city projects that the cost of the capital for this is around $4 million. As Vanetta identified in her remarks, the Arcora Foundation, funded by Delta Dental of Washington, will contribute $3 million or 75%. Better Health Together's Medicaid Transformation Waiver Funds will contribute $250,000. The Empire Health Foundation's Community Advocacy Fund will contribute $200,000. And key funders and leaders in Spokane will secure the balance of $550,000. These funds are included contributions from healthcare payers and providers. We're still in the process of fundraising and we'll have the details by the 31st. The question of why now has also been raised. Smile Spokane and other partners have continued to look for an opportunity to bring up the topic of community water fluoridation in Spokane again. For 5 years, Smile Spokane continued to conduct outreach events and promote the many benefits of fluoride. Over the years, we've kept the City Council updated on oral health challenges in Spokane. COVID-19 has put additional pressures on oral health access and health equity needs. We don't know how long the COVID-19 will last, and we believe this is time for the leaders in our community to promote policies that will improve the health in our community. Fluoridation is an administrative decision of the city, not subject to citizen initiative. Though it has been put to citizen vote, that's only advisory, not law. The City Council has the authority to implement it by councilmatic ordinance, and so we ask you to do that since this is a matter of health equity. Community water fluoridation will help people living in poverty and people of color, young children, older adults, but it'll benefit everyone. It'll have an impact across the entire population. So what is our ask? Really, the ask of the City Council is to pass an emergency ordinance to begin water fluoridation in Spokane for 3 specific reasons. Spokane's oral health challenges. As has been stated, we have higher rates of cavities and oral health problems than most other communities in the state. We're the largest city in the state without a proper balance of fluoride. For health equity, like many issues, oral disease is higher among people most impacted by systemic inequities. Children in low-income families, Black, Indigenous, and people of color, people with disabilities, and our elders. Community water fluoridation is the most universal way to get a good balance of fluoride to everyone in the community, regardless of their age, education, or income. We can no longer deny our community its best option for dental health. And as I mentioned, the state Supreme Court has ruled that this is an administrative decision of the city. Finally, COVID-19. The pandemic is showing the cracks in our healthcare system. COVID-19 is disproportionately affecting communities of color more than others in Spokane. It is critical that we reduce the stress on hospitals and healthcare workers by reducing the number of people seeking care for conditions that could have been averted. Dental conditions are a leading cause of visits by adults to hospital emergency departments. So thank you, and please know you will be receiving signed letters of support around 3 p.m. today from Smile Spokane. Thank you.
And I don't remember who else might be speaking on it, but we have a few more minutes, and then I'll open it up to council questions.
This is Jeffrey Bell, President Beggs and City Council members. Thank you for the opportunity to present today. I am Jeffrey Bell, Interim President of Empire Health Foundation and the Empire Health Community Advocacy Fund. Earlier this month, the Advocacy Fund voted unanimously to urge this council to vote to fluoridate the City of Spokane's drinking water at the August 31st City Council meeting. Our board members include former Washington State Department of Health Secretary Mary Selecki, pediatrician Dr. Lucita Francis, Dean of Students at Whitworth University, Rosetta Rhodes, President of Boughton Construction, Bill Boughton, and President of Frontier Behavioral Health, Jeff Thomas. They are unified in their support because they trust the science and studies that show fluoride works. They know that prevention is the best way to lower healthcare costs, and they want to close the health disparities fully exposed by COVID-19. Each day delayed in fluoridating the city's water means another day of a widening health gap for our children. We are just one of over 50 community and health organizations that support fluoridation. The groups are diverse, but unified in their message to you. Vote yes for fluoridation. We know there's a capital cost to implement fluoridation, and we are one of several organizations that are committing funds to ensure the city's taxpayers do not bear that cost. Our board has committed $200,000, Better Health $250,000, and we are confident that we can raise the remainder. This is a very personal issue for me. My father came back from World War II and opened a dental practice in a small town outside Portland, Oregon. He saw firsthand the difference between those children and adults with fluoride drinking water and those without. He became a leading advocate during his 45-year career. As a result of his advocacy, he received hate mail and threatening phone calls. Sadly, that still occurs to this day. But he never backed down because he knew what was right. This is not about being conservative or liberal or winning the next election. This is about leadership. It's about doing what is right. You are leaders in this community and have the unique opportunity to impact the health of all your constituents, including the elderly and children for generations to come. What a legacy for you and this council. Know that casting a yes vote, you are fully supported by our healthcare providers and so many others whose only motive in this is the health of our community. Please vote yes for fluoridation. Thank you.
All right, thank you, Mr. Bell. And I'll open it up to council questions in a moment. But first, I just wanted to confirm that we were able to make connection with Safe Water Spokane, and we are having a Thursday forum from 6 to 8 with folks from the water quality from the state of Washington and pro and con on fluoride with community comments where people can sign up. And so we'll have opportunities to hear from both sides, and really not so much us will be there as well, but really the entire community can hear from those sides. But with that, are there questions that council members have for any of these speakers or for any staff that are here?
Council President?
Yes, Councilmember Cathcart.
Yeah, well, I guess maybe this is a question more directed towards you. I guess I have a lot of questions, concerns, technical questions. I mean, when is there going to be an opportunity for council to really substantively ask these questions kind of outside of just sort of the advocacy and the PR efforts?
Well, we can ask them whenever, but I don't know if... I
mean, a public forum, I guess, is there going to be time on Thursday for that to happen?
Yeah, there will be. Yeah, there'll be... so the way it's going to work, there's really the three perspectives, just kind of the neutral water quality people from the state, the con and the pro, and we have it set up for council members can ask them questions during their portions of the presentation in the first hour. And then the last... I have a lot of them.
Okay.
Well, and if you get us anything in writing ahead of time too, that will just make it go faster. So feel free. Councilmember Stratton.
Hello, everyone. I just have a quick question. Does anybody have any data on allergies to fluoride? I've gotten a couple phone calls, some emails, people saying they're deathly allergic to fluoride. I was going to do some research, but I thought since I had everybody here, I would just ask, is there data of people that absolutely can't? I know we've got some amounts of fluoride in the water, but can anybody answer that?
Dr. Sledge is available to do that if we unmute him. Let's see. Okay, go ahead, Dr. Sledge.
Yes, that has come up in the past, and the American College of Allergists has on record saying that there is no established incidence of a true allergy to fluoride. As always, some people are more hypersensitive to any particular thing, and perhaps some people who say they are allergic to it are simply hyper reaction to it. But to answer your question, no, there is no documented allergy to to fluoride. And if you stop to think about it, it'd be pretty hard to have an allergy to a natural element.
Thank you.
Councilmember Mom, did I see your hand earlier?
Hi, this is just a lot of folks here with a lot more information about fluoride than I certainly have. Can you hear me okay?
Yes.
Okay. First of all, thank you for all the time and energy that you've put in to bring this forward to us. I do have some concerns that we haven't really done a full-fledged community outreach. I know we're pedaling really fast. I just want to share with those of you who've been working on this for so long, for us to declare an emergency and make a decision really in a week from now, I would like to think we could get all our information together in that time, but it may not happen. We provide water not just to the city of Spokane, but to several communities, including thousands of residents in Spokane County, whom I'm not sure we've had enough opportunity to communicate with. It is an important public health issue. This, of course, has been on the ballot almost 20 years ago, and they certainly, those who've lived here for a long time, but we have a lot of new residents as well. So I'll be talking with the rest of my council about just the timing and whether is a declaration of the emergency the right way to go. I'm very interested in this from a health perspective. I wish there was a better solution so human beings don't have to ingest fluoride, that we could have it, just topical on the teeth and we wouldn't all have to swallow it. I know some communities have some options for non-fluoridated water for those who are very fearful about it. I think Olympia does that. I'm exploring what that might look like in our community, especially for people who have infants if they're concerned about the powdered formula. That issue has come to me. So I just wanted to mention that we all are working on this very hard. We have other issues too that are also pressing this week. So if it doesn't happen on the date that was chosen, which honestly I didn't know this date was chosen as the target date, I'll do my best to get all the information so I can make a timely decision when it does come forward. Thank you.
Thanks, Councilmember. Scott Simmons, I think, is on from Public Works, and he asked for some time to talk about a few things. Scott, go ahead.
Thanks, Council President. Just on the operational side, some things for Council to consider as they're weighing this discussion. As many on Council are aware, the city had engaged a third-party consultant in 2004 to provide a feasibility study on the fluoridating the city's drinking water. That study was referenced by a number of folks in this comments. The study was updated in 2016. The outcomes of the study was to provide an estimate of capital costs and infrastructure that was needed to fluoridate the system, as well as the ongoing annual operating and maintenance costs. It's important to note that the estimates were planning level only. These estimates often deviate 50% from the actual costs once a full scoping is performed. Those scopings would include on-site evaluations, structural building assessments, mechanical, electrical requirements, that sort of thing that would really inform on a much better number to consider with regards to the impacts on the capital and O&M. The next step that would be performed, should Council approve the ordinance, would be to develop and issue an RFP for a third-party consultant to perform a detailed engineering study. This study would inform on a much more detailed level of the items that I mentioned before. So just a high-level estimate of what this effort would look like. It's a couple of months to develop an RFP, likely up to 3 months to have an RFP process take place and contract. A consultant study could take up to 9 months. We'd have an internal charter that our ICM team would do. That would be a couple of months. And then you're talking likely 6 to 8 months to design and develop the infrastructure needs for each of the wells and pumps in our system. As you're probably aware, our system is not like every other system out there. Tacoma's they have a water treatment facility that they do all of their fluoride injections at one location. We have 6 wells and 32 pumps to consider. And a construction estimate is just an estimate right now. It could be 4 years plus to do that. So some questions to consider as council negotiates this grant agreement does the agreement consider the time frame needed for the engineering study? Does it consider how an engineering study would be funded? Does it consider how capital costs would be funded if the estimates are determined to be higher than the $4 million planning level estimate? And then we'd have to look and see what an engineering solution would look like for providing a non-fluoridated location. So again, does the agreement consider how those costs would be funded? So just some things that I wanted to make sure council was aware of, thinking of just from the operational side of the equation.
Hey, Scott.
Thanks for the time. Yes.
Councilmember Cathcart here. Hey, is it, in your experience, since you've been with the city, is it typical that we would approve a pretty big operational change without knowing all the costs beforehand?
That's kind of a deep question. We certainly, from our standpoint, we would want to make sure that we had a pretty good handle on the cost before we ask council to confirm a contract. But there's various points that you go through, even with grant agreements. They're estimates, and every step you go, whether it's a feasibility study, then it's a engineering study, then it's our internal design team doing work. Each of those steps inform differently on it, and so it varies from time to time as you go through those things. I'm always an advocate of having the most valid information available so that council can make really good decisions on the impacts and the costs associated with it.
And in your thought, if the goal here is to have paid for by these third parties, sort of an MOU that guarantees that those costs be covered, since this is an enterprise fund.
I heard that last piece. I was trying to mute so you weren't muffled. Can you ask it again?
Well, yeah, just wondering if we should have some sort of an MOU with these third parties that would guarantee that 100% of the costs are covered, especially since this is an enterprise fund that's supposed to pay for itself. Otherwise, we'll have to, I assume, raise rates or something like that. Is that right?
That's part of the reason I raised the questions for consideration is in the event that the costs come up higher, how do those get contemplated? Are those going to be paid for by ratepayers? Is there going to be an ask for additional funding? I think the desire by the participants on here was to provide the cost recovery or the capital coverage for those. So as we progress through the process, as the engineering information informs on a different number, how do those things get contemplated?
Okay. Thanks, Scott.
All right, and I'm not sure if there's someone from Arcora, but I believe you have been working with cities across the state to help them install fluoridation systems over the years. I don't know if there's anyone there that can speak to that.
Hi, this is Vanetta. Yeah, I'd like to ask if Sean Pickard could weigh in on this because I've been here a little bit less time than most of my colleagues, or Emily.
Okay.
I'm happy to weigh in, Vanetta. I think Sean is not on the call at the moment. So I would say we have worked with numerous communities around the state and to bring fluoridation, and every city has their own process, and we endeavor to work with the city. Our real goal is to provide improved oral health, and for that reason we provide these funds. And so I think we would have a contract in place for funding, and there is a exhibit on that can be adjusted over time. So certainly have your city staff look at that, and we are available for conversations around that, and looking to just guarantee that really our dollars are maximized towards improving oral health with how we're engaging with communities.
Okay. So thanks, everyone.
Does that answer the question?
Oh. Well, I just wanted to, in terms of whether or not your team, when they came up with their estimates of how much money it would take, did they take into Spokane's previous engineering work and their work getting water fluoridation up to speed in other communities?
Yes, we looked at the experience. We've looked at worked with an engineering firm that we've worked with in other communities to look at our estimate. And really that 2016 estimate is, we think, relatively accurate compared to the other work that we have done. Certainly, it has been 4 years since then, but that is not that long a time in a scope. Yes.
Okay. All right. Well, we are a little over time for this topic, so I think we'll wind it up for now. Again, we'll have a more forum and more conversations between staff. We have the grant agreement and the ordinance out for comment to administration staff. We look forward to hearing back. Sorry, Candace, go ahead. Yep.
Just real quick, can someone tell me why the 31st of August is such a magic date?
I don't know that it's magic. We sent that around several weeks ago to people as just part of the process for moving through it. But that's a good point for us to discuss. So, but there's nothing externally. I don't think there's not a certain deadline or anything like that. So, yeah.
Thank you.
Okay. Well, thank you so much, speakers. Have a great day. And then I want to move a little out of order, as I said before, the Highway 195 corridor. I've got Mike Gribner, I believe, on the line from Washington Department of Transportation. I asked him to give us a little bit of an overview of the challenges that he has been communicating to council and the administration about it. And some of the potential solutions from their point of view. And then we'll get into the specifics that Councilmember Cathcart raised about J-turns near Eagle Ridge, I think. So, Mr. Gribner, if you're there, hopefully you're...
So can you hear me?
Yes, I can. Thanks, Mike.
Ah, great. I never know.
Yeah.
So thank you, President Beggs, and I want to thank the council for giving me a few minutes here to talk about 195. So I didn't put a presentation together. We've certainly had some discussions already around this topic, but what I would share with you in the brief time I have is the highway itself, the capacity of 195 is not the concern. The concern is getting people off and on the highway and getting people from 195 onto Interstate 90. So, as you know, we put a ramp meter in on I-90. That was to control flow onto I-90. That is creating some delay on 195 during the peak hours. So let me speak to that for a minute. As it stands right now, roughly there are 11,000 vehicles a day just south of Hatch Road on 195. There is about 22,000 vehicles a day entering I-90. So the doubling of traffic that takes place in that short segment is the flow of traffic coming in out of the developments onto the system to use it. What we can see looking forward, there's an extensive amount of potential development still in the area. If we were to apply some trip generation to that, we suspect the amount of traffic could end up being as high as 55,000 trips if all the development was realized. The connection to I-90 doesn't work particularly well now. It's operating at a low level of service. It's also a place that is very uncomfortable to drive. We hear about it fairly often. It also creates accidents in the area of the connection. The other thing I would point back to is getting on and off the highway is creating a significant amount of at-angle accidents. We are certainly trying, as an agency, we have moved as fast as we could develop funding and trying to curb some of that activity, but we're not in a very good place to fund projects right now. So if we're talking about flowing 11,000 vehicles into the system right now and have the crash history due at this point, I would ask you to speculate with me what kind of crash history we might have if we had 55,000 vehicles or an additional 40 or so, 45,000 vehicles flowing into that system. The reason we have taken the position we have and why we have reached out to the City Council and to the Mayor's office on this issue is we need to find a solution. for both of us. So I don't know if that's adequate.
Mike, let me just ask, to sketch a little bit, I realize there's a study going on and we're not going to hear back for a year, but in terms of the types of solutions that the city might be requested to help fund, could you talk a little bit about what that is? Because my understanding is it would include city or off-highway streets that the city might need to fund as part of the solution, working collaboratively with you.
Yeah, so a good deal of the traffic that comes onto 195 out of the neighborhoods disappears into the downtown area. So, and there's a couple ways to look at those statistics, but essentially the system is being used for very short trips. Mm-hmm. Generally, we, from a system standpoint, would much prefer to see those trips on a local network. They're very short in nature. They're very directed to the city. That is really part of what is going to be the solution is, can we divert trips off of that connection, off of the system that's currently being congested, onto some sort of local network to handle the trips in a more a typical fashion where those local trips would stay on a local system. So we have certainly expressed interest in diverting trips in the short term, for I think we've talked a little bit, President Beggs, about where that might be, what options that might end up being. Certainly, there's now interest in the development community in that. We're seeing some ideas starting to spawn out of those conversations related to ways to do that. The trade-off, if we can't find a way to do that financially, is we would have to be focused on the connection itself, which is a very, very significant expense, somewhere in the $300 to $400 million range, depending on whose price tag you use. I do not see a clear path to that kind of funding right now. I'm struggling to find a clear path to much funding at all in this current environment. I know there's a need, a desire even, to find a way to allow development to continue down there. And I think that, quite frankly, the very blunt answer is diverting traffic off the system is probably the best way to do that. That capacity created could be used to continue growth. And again, I got to come back and say this is a twofold issue. They are connected. You cannot separate them. Getting traffic off and on the system safely and finding a way to unload the connection at I-90 are one and the same. So from DOT's standpoint, both of those things really need to have some level of outcome in this discussion before we're going to be friendlier to the development discussion.
Okay, so, but just in terms of ballparking, if we were to either upgrade or build local network streets on either side of 195, is that in the tens of millions types of budget as opposed to the hundreds of millions? What's the...
When we looked at this many years ago when we were first working with the city, this is decades ago now, we were talking about local infrastructure, modernizing those numbers. You might be talking about collectively something in the $40 million range. Mm-hmm. But again, that does not have to be solved in one $40 million expenditure. Mm-hmm. If you make a decision to divert traffic, and one of the options, Council President, that we've talked about is, moving traffic into town through the old highway. And there's 2 or 3 different ways that that's possible. The trips that are diverted out of that create capacity in your decision making, which gives you opportunity to stage your development or to make decisions to manage the discussion. We certainly would not be opposed to that kind of that kind of outcome, as long as there's a bigger plan in play.
Right. Councilmember Cathcart. Councilmember Cathcart, and then Councilmember Mumm after that.
Real quick, is this something where, and probably not the most perfect solution, but widening and enhancing like Inland Empire Way to divert traffic? Is that something that could be a feasible alternative to move traffic off of 195, or would Inland Empire Way need to be like extended further in order for that to work?
So I think Inland Empire Way is definitely one of the alternatives that will need to be looked at. The details of that are going to come out of hopefully a little closer look by a consultant in the study that SRTC is doing. But we are certainly, that was some of the discussion we had years ago. There really are only so many choices available to us in that narrow corridor. Certainly on the other side of the road, there is some discussion about can you extend some sort of local infrastructure into the old Sunset Highway. We had at one point designed something that did just exactly that. So again, there's 2 or 3 different ways you can approach that discussion that will divert trips effectively. But Inland Empire Way is certainly one of them.
Okay.
Councilmember Mumm.
Yes, thank you. I just have a couple questions. Does the development community or any developers in the area have any kind of financial obligation to contribute to the improvement of the traffic system there that you're aware of?
So I believe that they do, but the city controls that discussion. You as a city organization control land use here. DOT does not. So there is mechanisms that are in place, if you will, to collect fees to help contribute to that. So I'm sure city staff can bring you up to speed on where that stands within the city structure.
Can I just keep going real quick?
Yes.
Yeah.
Yep.
Okay. And so then have you also modeled what it might look like if STA actually started serving that area?
I have not modeled it. We are certainly very supportive of that. We think that alternative would support the overall discussion in terms of how trips are actually relegated to the system. So hopefully that'll be a discussion that has a little more texture as this study develops. But again, supportive of that as a concept, absolutely.
Thank you. And then how much responsibility, I guess it's a question for us, but maybe for your organization to discuss, does the city of Spokane have here versus, say, the county or other communities that are adding vehicle trips into the system?
So a complex question. So I will try to give you as simple of an answer as I can. GMA suggests that there needs to be concurrency in the transportation plan. I would argue there is not concurrency in the plan down there. So I think that's a jumping off point for the discussion. But to your point, as we develop other areas of the city, other areas of the county, and they contribute traffic, we are engaged in those discussions to the best of our ability in the same way we are talking to you about this area.
Well, thank you for recognizing that, because I think that's where the discussion, especially if there's traffic impact fees being talked about, we want to make sure it's fair. And there's a lot of different people who use that corridor, not just citizens.
Yeah, and if I may, just take the liberty of adding one more thing. We have always felt, the agency has felt, if we can find a solution here, I will certainly advocate for funding. This is going to require, we're going to need some help to fund this properly. But what we don't have, and this is a discussion I had with previous councils through generations now, literally. We advocated for this funding and did not get it over the multiple decades, partly because the unified plan that was originally discussed was no longer a unified plan. And one of the things that I've asked council and the mayor's office to contemplate here is, can we get back to a plan that we're agreeable to, which generates, quite frankly, some horsepower in the conversation about bringing money to bear. So that's certainly one of the things that is needed here, that we don't have a plan right now on how to deal with this.
I can read between the lines of what you said. Thank you.
I couldn't tell, Councilmember Kinnear, if you had your hand up earlier or not. Oh, and I'll get Kate, and then I'll get Michael. But Councilmember Kinnear first. Go ahead.
Thanks. Thank you, Mike. Can everyone hear me? I'm having computer issues.
Yes?
Yeah, I can hear you fine.
Okay. Question and then a comment. Mike, has any modeling been done about what happens when you take the cars that would, if you decide to increase the capacity of Inland Empire Way, when they get dumped off of Inland Empire Way, what is the capacity for that road network to handle the number of cars that would be going into downtown or areas north or west?
So those cars are coming into downtown now. So the detailed question would be where the connections are.
Yes.
And so I have not modeled that yet. Again, I believe that's part of the conversation that we're hoping comes out of the discussion with the study that SRTC is leading. And again, we will get into more detail as we formulate a plan, and we certainly will be at the table helping folks sort that out.
Okay.
But what I would tell you is those trips are going there now. They're going downtown now.
And that's not exactly my question. They are going down there now, but the connections would be different. And so creating bottlenecks for people to get from the end of Inland Empire Way without them traversing through a neighborhood where the streets do not support that kind of traffic density would be my question. How do we get them safely to where they're supposed to go? So the other piece is if we do make capacity available using arterial streets, we need to be sure that into the future, those streets are going to not just be at capacity, but be able to accommodate more capacity, because growth is not going to stop down there. And growth is happening outside the city limits down there as well. So it's not just the Eagle Ridge people, it's further south. And then finally, I want to say to all the council members, a study is going on right now. And it's almost premature to be talking about what ifs when we don't know the outcome of the study. So there's a lot of angst around, we've got to get this fixed, but we still have a study going on. And I want to make sure that the voices of the neighborhood, this is my neighborhood, want to make sure that the voices of the neighborhood folks are heard. Also want to make sure that we're being equitable with the other areas in the city. So in the 5 Mile area where there's so many bottlenecks, or in District 1, which has unpaved streets, I want to make sure that we're being equitable when we say, well, it'll take about $40 million to fix this. That's money that's not going to those other areas. So that is also a concern of mine. So thanks, Mike.
And Kate Burke, Councilmember Burke.
Thank you. I just wanted to say that I pretty much similar to Councilmember Mom and Kinnear. I'm not interested in throwing a bunch of infrastructure money to widen streets for cars. I think there's other innovative ways that we can solve this problem, and I think transit is a big way that we can look at solving this. And I just want to say that we have other stuff going on in other communities that's really big as well. And I'm glad that we found out that obviously we have the impact fees, but if there's other ways to get those developers to actually put forth money to build infrastructure, and maybe put forth money towards transit options or things like that, or even do something unique like what Kendall Yards does, is they give a free bus pass to everybody that live and work there. And something like that would be really helpful if we had transit service over there. So there are other ways to go about it than just building roads, and also diverting traffic through neighborhoods, because we have to think also about, pedestrians and bikers and all the other infrastructure that we want to put together. So, I'm glad we're starting this conversation, but we do have that study coming from SRTC, and I think it needs to be kind of a holistic approach and not just widening roads and building more concrete and cement for vehicles per se, especially single occupancy vehicles. I think there's other ways to solve this issue.
Thank you. And then Councilmember Cathcart.
Yeah. Hey, Mike, another question for you. And part of the reason why I wanted to have this on our agenda today was there's a development, and I think probably multiple developments that are trying to get off the ground off of 195 there, and there are some requirements for infrastructure investments, J-turns that need to be made. And so I'm just curious if there is, any sort of money in the intermediate term that WashDOT has to help fund some safety projects like that. Because obviously with the impact fees, there will still be some additional dollars that would be needed to fund those. But those developments can't obviously occur without getting that infrastructure in place. And then I would actually piggyback on that as well. I certainly have concerns as Councilman Kinnear shared with the equitability of spending a lot of money on this part of town and not necessarily seeing those funds that would definitely be well invested in other parts of the community, such as Northeast Spokane. But we do need housing. We have a housing crisis. We need to get these units up, and so we do need to find some solutions. And so if there are some options, anything that WashDOT has or can do, it would certainly be very much, I think, appreciated and necessary. But also, I'd be curious to hear if there's out-of-the-box ideas. I mean, Councilman Burke even just brought up the transit concept, and I think, could there be some options where developers maybe make a commitment to trying to encourage more transit use and providing, bus passes and things like that, sort of as a form of an impact fee, if you will. And I just wonder if there's other places around the state where maybe some out-of-the-box things like that are being done that will help accommodate development when there maybe isn't as much money as is needed for some of those additional infrastructure investments.
So quite a bit there.
Yeah.
So let me try to address that best I can. If I get lost in this, please redirect me. So I guess I want to speak to several things in this conversation. So, but first, do we currently have money to bring to this discussion? The answer is we do not. We are facing a significant revenue shortfall. So in the near term, this is a very challenging conversation for us. We have already put a J-turn in there. We've already participated in putting an interchange in down there. We certainly have not built the infrastructure down there that we expected to see to back the development. So we are in a significant infrastructure deficit down there. I am very open to solving that in non-traditional ways. I certainly would not close the door on ideas related to transit or anything else that facilitates the outcome of diverting trips or diverting single occupant vehicles or however you want to consider this conversation. I think the challenge I have in this is there's a lot of ways to think about equity. I've heard all of you talk about equity around the city. I have my own equity perspective, my own equity lens on this related to what position the agency is going to take on the development. I've made that pretty clear. The concurrency related to the development down there needs to have some sort of resolution. So again, I'm pretty open to what the resolution ends up being, but without it, DOT's posture is not going to change down here. So I think that's something I need to reinforce. We're happy to work with you. We're trying to have meaningful conversations about what to do to make this work. But we need a plan. I mean, it's that simple. We do not have a plan yet.
Are you, just to follow up, are you seeing or have you seen any other places around the state that have done out of the box kind of ideas to try and connect these sort of, disconnected portions of a community rather than traffic on a highway?
So that's a tricky question. So I'll answer it this way. Probably the best way that I have seen this addressed is in some level of build-out discussion. In other words, how we're going to move to this first place, and then how we're going to move to this next place, and how we're going to move to this next place, as opposed to trying to bite off the whole conversation at once. And those things, in my experience, often have these other components in them because they matter. If you can divert trips through transit or some other method, you're still diverting trips. You're making the concurrency work. So
what I have tried to articulate several times now is we're not a hard no on this unless there is a gold-plated plan. What we are is looking for a plan that can go to the next place, and we can open up a certain amount of development that we can actually support. When we get to that place, we're going to have another step in the conversation. So I think that's probably what I would consider to be, at this point, sort of innovation. What we put into that conversation to make those steps work is also some level of innovation. Again, as you know, down there, there's, from a land use standpoint, the trips have to go somewhere to get basic services. There's not transit down there. The only fire station down there sits on property that we gave to you. There's a lot of things that make the trips worse in terms of how the development took place. If we can solve some of those, it will definitely help.
One last thing. Would it make any difference without necessarily reducing capacity, but if you simply slowed traffic, if you somehow could build, whether it's stoplights or roundabouts or something that slowed traffic, maybe added more on and off ramps or something to reduce, the number of cars that have to go the full length? Is that an option that would be that would be an improvement that would help?
In my opinion, not particularly.
Okay.
So first of all, there's a couple things that I have to put on the table as the responsible steward of that system. So that is very nearly the same thing in the system hierarchy as the interstate. So like it or don't like it, that's a charge that I have, is to maintain that integrity of the system. So as opposed to, say, putting a roundabout in, which I'm quite supportive of as a typical operational solution, we have went to J-turns, which do something similar to a roundabout, but they don't impede the mainline traffic as much. Because what that system is there to do is move freight and regional trips. That's why it is there. And there's been a significant investment made by the public over decades for that system to do that. And so to just change that is a bit of a taking from the public's investment. We're not really interested in that. The other thing that I would share with you from a signal standpoint, and I really want this conversation to find a place with the council. So high-speed signals, which I would consider anything over about 35 miles an hour, are just not a good idea. So even if I thought there was a reason to put signals in here, and I don't, I wouldn't put signals in here because it would make the safety situation worse. So in my view, signals are just simply not on the table. And I think when you get into the conversation about roundabouts, I would tell you that we would want to see a J-turn instead. It does pretty much the same thing. It forces people to make one decision point at a time, which is a big advantage of a roundabout. But it operates the system more in line with the integrity of what it was intended. So it's a trade-off we can make.
All right. We're over time on this one, but it's a super pressing issue, and I really appreciate you, Mike, taking some time out and learning about fluoride along the way while you waited. And it's a very thorny problem, and I'm really glad that we can start this conversation and look forward to more. So I want to move on to our next is our monthly report from the Sustainability Action Subcommittee, and that is Kara Odegaard who's going to kick that off. Thanks again, Mike, so much. We'll look forward to more talk.
Thank you, Council President and the Council, for having us here today. I'm just going to share my screen. And as I'm doing this, I'd like to introduce to you Dr. Brian Henning, who I've invited to help with this presentation. Dr. Henning is the Chair of Environmental Studies Department at Gonzaga and a Professor of Environmental Studies and Philosophy as well. And he's also been a member of the Sustainability Action Subcommittee, Sustainability and Climate Action Planning Work Group from the beginning. So he's very familiar with these key recommendations Both these recommendations that we're presenting to you today have been vetted through the normal SAS process. As I think most of you have heard by now how that works. So I won't go into any details, but I'll head right into the recommendations. And I'm also going to pass this along to Dr. Henning.
Good afternoon, Council President, Council members. Thanks for having me here today. It's nice to be with you, even if only virtually. As Kara mentioned, these are two recommendations that the Sustainability Action Subcommittee has been reviewing for quite some time. This first one relates to the Spokane greenhouse gas reduction targets. As you probably know, we already have in Spokane Municipal Code Title 15 the goal of a 30% reduction from 2005 levels. And that's been in code for a good while now. That target and many targets of many jurisdictions around the country and the world were largely set arbitrarily for a long time. And we finally have the science and the clarity to make it clear how, at what pace we need to be reducing emissions. So what we're suggesting is to update our greenhouse gas emission reduction targets to better align it with the state of the science and with the Washington State targets, which have also been newly updated. We ignore these things sort of at our own peril, just to remind us of the extraordinary fires going on again this year in California, and we get a sense as to the importance of planning for these things and as early as possible. So this table that you're looking at here on your screen, hopefully, is laying out for you different targets for different jurisdictions. At the top column, we have Spokane's current target. The second row is the proposed update via the recommended ordinance. Then below that is what Washington State had prior to last spring when it updated it. It's the state law. So that row that says Washington State post 2020 is currently state law. And then we have the international targets at the bottom. So basically, to make this short, the idea is here that 30% reduction by 2005, our current targets are much too modest in order to be able to sufficiently address the problem. It's clear that by 2050, we need to end up at net neutral, meaning that we need to have effectively eliminated emissions by the middle of this century. And then the interim targets in 2030 and 2040 are just trying to make the bites that we take manageable. So if Curry, you go to the next slide, I think it would show what we found in our most recent greenhouse gas inventory. This is a breakdown of our emissions. If you sort of put this into two big categories, the first big category is roughly energy, where if you combine our electricity use and natural gas use, we get about half of our emissions created by that sector. And then the other half by transportation. The reason why we're showing you this is to get a sense as to how difficult or easy it's going to be to achieve the goals. We're recommending a 45% reduction by 2030, so within the next decade. One of the things to note, as it says on the left-hand side of the screen there, that Washington State passed the Clean Energy Transformation Act last spring. One of the things that means is that Washington State will be cleaning its electricity grid so that by 2030, 80% of the electricity produced in the state will be clean, with all of it being net neutral clean. What that means effectively for us is that the 28% of our emissions coming from electricity will be gone without us having to do anything by 2030. So we'll have achieved 28% of our 45% reduction, leaving 17% left to achieve between now and 2030. So that 45% sounds daunting, but actually it's more like 17%, which would need to be achieved through a mixture of transportation-related emission reductions and fossil gas reduction as well between those two. Carrie, did you want to add to that? Nope? Okay, she's good. All right,
no,
so...
I think you're doing fine.
Okay, stop me if I forget. One thing also to mention is that the Clean Energy Transformation Act that the state has passed will also require our utility to be 100% clean by 2045. The electricity will gradually be taken care of. Avista itself as a corporation is committed to achieving net neutral greenhouse gas emissions in Washington State by 2027, even more ambitious than the Clean Energy Transformation Act. So those are promising developments, and they leave an appropriately ambitious amount left for 2030, and then the goal would be a 70% reduction. I don't know if the next slide is the table again, Kara. So again, that second row, the Spokane proposed ordinance would be 45% in 2030 and 70% by 2040, so that we then have that final 30% by the middle of the century, aligning us with the science. The second recommendation is maybe best seen as one of the ways that we think that the city can help its residents to achieve our greenhouse gas reduction goals. So as you know, in that donut chart, a lot of our emissions are related to the activities, not that the city is itself doing, but rather what our residents of the city are doing in the way that we use transportation, the electricity that we use, and so on. This tool from Community Climate Solutions, a nonprofit organization that was started by a group in Berkeley, California, they wanted to create a way for people in their city to learn about easily how to do two things: to reduce costs related to the use of resources, water and electricity and gas, transportation, and then secondly, how to thereby at the same time reduce our emissions related to those things. So the basic idea is that it is an online tool. If you've ever used a footprint calculator, if you've ever calculated how big your footprint is, this does that. It has a very nicely sophisticated tool to calculate your emissions. But unlike those other tools, it gives you all sorts of practical solutions that you can choose to do. You say, I'm going to try and walk more. I'm going to try to use less water. And then it actually tells you how to go about doing that in our community. If we buy a subscription to this as a community in Spokane, we're able to customize all the advice that would be related to water usage, related to waste, related to transportation. And as you know better than I, we already have all sorts of programs going on throughout the city related to energy, waste, water. And so that this tool would actually help us potentially achieve those ongoing city goals, give us a way of communicating with residents, give us a way of tracking exactly what the impact of those things are, and making it easier for residents to adopt these strategies. And then finally, sort of in a nod to the social media world that we live in, there's an interesting social element to this that you can choose to use. You can run competitions with your church group or your book group. You can post actions that you take in a social media style platform through the dashboard, which then encourages positive reinforcement within your community to try and achieve the goals that you've set for yourself. So we recommend this is one of the strategies for helping Spokane to achieve the pollution reduction targets that it's setting for itself.
And if I could just jump in, I think one of the other great things about this tool that's different than others that are out there is that at each one of the actions that these higher subcategories are associated with cost savings for the user. So, for example, if you wanted to find out how much it would cost you to replace your lighting with LED lights.
Kara, you're hard
yes,
to understand. I don't know if your volume's up or something.
Maybe Brian, if you put me on the cost savings.
Can you hear me okay, Brian?
Yes, I can.
Okay. Yeah, Kara was just mentioning that one of the nice things about this is that each of these strategies tells the user, the resident, how much money they could potentially save by implementing the policy or the habit change. And so it has as we know, we have a lot of low-income residents in our area, and so this would actually potentially, it's not just simply put a bunch of solar panels on your roof for wealthier residents. It's actually lots of good strategies, even for renters, things you can do, and how much money it would cost to implement, and how much money you would save if you implemented it.
Great.
So looks like we have 4 minutes at least by my count. If anybody has any questions.
Councilmember Cathcart.
Yeah. Hi, Brian. I set aside some time earlier today to talk to Kara about some of these issues, so I don't really have any questions per se, but I just wanted to say, specifically with regard to this tool, I think, at first blush anyway, I don't really have any issues with it. In fact, I think it's probably, one of the best ways to tackle some of these issues is to show folks individually how they can reduce their own impact on a personal level. I think gamifying it is a great idea. Create those competitions, and certainly showing people where their cost savings, which I think is how people make these choices, is where those cost savings are going to come from. I think that's a really good thing. So again, at first blush, anyway, I think I'm supportive of this tool, and I think it does make sense to adopt something like this. So,
great, thanks.
Can I ask a question?
Yes, go ahead.
Hi guys. I just wondered what our push to kind of get corporations to limit their use, because I feel like a big chunk of it comes from the bigger corporations around here, and I'm wondering what kind of push is going to happen there.
Kara, are you still there? Let me know if you want me to take this one. I think Kara might be having connection issues. Hi, Kate. So I guess one of the responses I would make is that state laws requiring our utility to reduce its emissions, and so some of that structural systemic work is being being addressed at the state level with the utility itself. Taking care of, eventually the pollution related to electricity generation. That does still leave the natural gas use, and so that's something that you would point to in terms of both industrial and residential use. Both. This tool itself, the We Renew tool, is aimed at individual residents. But I could imagine creating incentives or other programs related to businesses as well. We really, I don't know if this is the spirit of your question or not. Businesses, municipalities, and individual residents all need to do our part to reduce this pollution, because we're all negatively impacted. And that you're right that as much as residents' emissions are significant, frequently in terms of electricity usage and natural gas usage, industrial users are frequently larger. Transportation is the one where individual residents are the major source, so they're a good focus. But right now, none of the recommendations that I know of are explicitly focused on businesses. I was hoping Kara would be able to still share, because of her work with her consultancy in B corporations. I know that she's doing work related to benefit corporations and how businesses themselves can reduce their impact. But I don't think anything from the SAS right now is related to that. But I'd be happy to be corrected by Kara if I'm wrong about that.
Is my microphone still not working?
Well, your microphone's working. It's just a lot of echoey, so I don't know if if you turn down your volume on your computer, we might hear you better.
It's all coming through my earpiece, so I'm not
okay.
sure what to do.
All right.
But we will be including commercial activity in the climate action plan, and so we have that study.
Oh, okay. It's not working too well. So, but anyway, very good presentation. Thank you both for that. And I don't see any more questions from council. So we'll be looking at both of these proposals and recommendations, which seemed to be pretty unanimous coming from the Sustainability Action Subcommittee. So thanks for that. And then last on council requests was a street sweeping update. Councilmember Stratton's request, and Streets Director Clint Harris, I think, is on the line.
Yeah, good afternoon, Council President and Council. I've got a presentation here to go through real quick to give an update on what we've done this year for the street sweeping. Mm-hmm. And can you see it okay?
Yes.
Okay, so the sweeping information that we have for this year is planned work. We had 7,300 miles planned. Year to date, we've completed right around 6,100 miles, which is 84% of the total planned. Our costs for the year running right around $411 a mile, which is kind of surprising for some people. As they hear street sweeping, you would think the cost would be less. The bigger costs are in the machines that we use to sweep the streets. So year to date, we spent right around $2.5 million overall for the sweeping program. I would point out the sweeping this year has not been affected by the COVID, so the crews have been able to work without any hindering. Overall, for the summer sweeping program, by district, we've got right around 77% completed in the Northwest. The Northeast is moving along quite a bit. We're right at 95%, and then for the South, we're right around 83%. We expect to be wrapped up and completed here by the time the winter hits. We've got quite a bit of, it's deceiving by the miles, but we end up having to hit our PM10 routes and our arterials and our other streets around the downtown area, along with the different districts that we end up sweeping. So that helps us to be able to keep the city cleaner. Some stats for just an average workday for one of the street sweeping crews. They will gather right around 18 yards of material on 32 miles of road, which is surprising, and right around 15, almost 16,000 gallons of water, which when you break it down by a mile is right around almost 500 gallons a mile, sweeping half yard per mile, and an average cost for a day is right around $13,000. Here's an exhibit of one of the sweeping challenges that we have. This is an example of where cars are parked over this area is between Maple and Ash over off of Maxwell. Our crews are challenged to get the material out from underneath these vehicles where they're parked, and this is what creates a lot of problems for our bikers that are trying to use the streets. So this isn't what happens in every bike lane, but we've been trying to place more of an emphasis and to get the crews to seek better ways to try to gather this material. And as you can see in the pictures here, this has quite a bit of material, and that's it's surprising how much our streets accumulate with all the work that's going on in the city. There's lots of material, and it just gets dirty. So anyway, one of the things that we are looking at doing for 21 is trying to develop a schedule so that people can understand how the bike lanes are being swept. So, we get a lot of feedback about bike lanes. We know that they're just as important as the lanes that the vehicles travel, and we think that we can develop a schedule and help people to understand how we are sweeping. Any questions?
Councilmember Stratton, do you have any questions or concerns?
I just want to thank Clint for doing this. I don't know about anybody else, but Councilmember Mom and myself had a few emails from folks wanting to know when their streets were going to be swept. So this was really good information. Clint did a really good job communicating with our constituents. So hopefully some of this material and information will be helpful. So thank you, Clint, very much for doing this.
Okay.
All right. Thank you, Clint, so much. Oh,
Hey,
sorry, Michael. Go ahead, Michael. Sorry.
Yeah, sorry. Clint, I had a constituent recently reach out to me, and probably similar to some of the concerns you heard maybe shared from Councilwoman Stratton, but they were wondering just how much of a delay it causes when there are cars in the way, and they frankly wondered if we couldn't set up a schedule, as you mentioned, and maybe even put signage out or something to let people know, hey, you need to have your car on the other side of the street, or off the street during this day or this time period. And if we did that, would that make your street sweeping more efficient, quicker? I'm just kind of curious, just the logistics of that, and if that's something that's been thought of, and if that would work.
Well, that's a really good point, and some of the it would actually kind of dovetail into our snow removal. I guess we do post the schedule, and we do alternate the schedule. I want to point out so that not every district gets hit at the same times. We try to alternate so that the residents all get a equal service from us. But that would actually be something that we could certainly look at. Is there some way of informing for those areas and doing a posting? So that's a great suggestion. We can certainly look at.
All right. Thank you again so much. And let's go down to staff requests, and let's do the street design standards. Inga Note.
Okay, good afternoon, everybody. Can you see my screen okay?
Yes.
All right. So I'm just going to take you through the current status of this. I've been to this committee before, and I know some of you have heard this already through my other venues I've been to, but I'll give you an update on where we're at. So still working on revising the final draft of the design standards along with edits to the municipal code. And right now I'm in the midst of getting a lot of feedback from various groups and community members, and so I'm trying to balance all those comments and make sure I'm listening to everybody and trying to balance their interests in the latest draft. So this is the current schedule. We pushed back our Plan Commission hearing to September 23rd. It was originally going to be 2 weeks before, but the comp plan amendments needed a little more time. So I should be putting out another draft probably in the next week or so. That would be the version that will be used for the Planning Commission hearing. So just some of the more recent changes, we've updated this table a little bit to add transit stops on the side there in the pedestrian realm. We maybe made a few little tweaks to this table, but not a lot of it has changed. It's still just showing how we want to be able to break down the elements of the street by type of zoning and type of land use around it. So we have different street widths depending on if you're in the center or corridor zone, whether you're in the downtown, if you're in a residential, or if you're in an industrial area. The arterial right-of-way widths, we are modifying this just to be based solely on the number of lanes that we expect to have there, and with additional width required if it's on our bike map shown as a future bike lane route, or if we need additional swales for drainage. We are still looking at some ways to adjust the residential street width. We have a lot of streets, the more recently built streets are really wider than they need to be. A lot of places we don't see people parking on them because they have 3-car garages and they just park in their driveways. Or like in this example, we don't even have homes on one side of the street. And so you have a lot of extra space out there, a lot of asphalt that we are maintaining that really isn't needed. So we've been having discussions with the fire department and with planning and with developer services and want to make some adjustments to our street widths, but we're still working out some of the details on that. I've had a lot of conversations about how we should better approach curb ramps. And so we want to get away from doing single ramps on our corners and setting them up so that we have 2 on each corner. Here's an example of one that was done fairly recently, and just I like this one because it highlights some of the constraints that we deal with when we are doing a road project and need to retrofit. So this is Monroe Street, I think at 7th maybe. And so it had no ramps to begin with. We have these historic rock walls that we didn't want to touch. The sidewalk is narrow. It looks like it was only 4 feet maybe in the before picture. We didn't have any right-of-way behind the rock wall, and then we have a catch basin right there on the corner as well. So we still ended up with 2 ramps in the after picture. The ideal setup would have been to swing that other ramp around to where the catch basin is in the image, but it's very costly to relocate those, and so this was the best solution that we could come up with at the time. So this is just to highlight why we can't always put them in exactly the spot that we would like to. So I made some tweaks to this adjustment, or to this section in the last week after getting feedback from the Plan Commission members. And so what we're trying to do here is just provide a little bit better information to our designers on how to orient the ramps for sight-impaired users of the system. So the underline is the newer wording here. But the goal is that for any new construction or reconstruction projects, we are going to put 2 curb ramps per corner and try to align the running slope, which is basically the down slope of the ramp as you're going towards the street, and make sure that that is parallel to the crosswalk and to the direction of pedestrian travel. But in situations where we're doing preservation work or retrofits, or maybe we're doing like our school safety projects where we're installing sidewalk on one side of the street and we have limited amount of funds. And in situations like that, sometimes we may only be able to put in a single curb ramp instead of 2, just due to constraints like relocating utilities or where we might have right-of-way constraints and things like that. We still need to have a way to deal with those situations. And this is just an example of what the SMC edit would look like to go along with that. One of the other big changes is that rather than using a fixed radius at intersections, we would use design vehicles and control vehicles to determine what the radius should be. So in this example, we set our curb radius for the design vehicle so that they can make a right turn without getting up on the sidewalk and without veering out of their travel lane. But the control vehicle would be the larger vehicle that we still want to be able to get through the area, but we don't want to design our streets to accommodate it because it is so infrequent. So just to give you an example of that, the design vehicle would be like a smaller, maybe a FedEx or a UPS truck, like the one in the upper right corner, and the control vehicle could be the fire department's ladder truck, or it could be a like a WB-50. We're also making changes to design speeds. Historically, we would design for about 5 miles an hour over what the posted speed would be. That's no longer really the standard of practice for urban areas. And so we're redefining that in the street standards
And I also recently modified this to include 20-mile-per-hour zones because we do have quite a few of those in the city. We're also updating our clear zone policy, which right now is basically 10 feet throughout the city, which is more appropriate for higher speed roadways. So for streets that are in the 20 to 35 mile per hour speed zone, we're going to shrink that clear zone, which allows us to put some, to keep our street furniture and do lighting and signals and everything that we normally have on the sidewalk. We will exempt all of those, but it basically helps us to deal with the narrow right-of-way that we would typically have on those streets and just recognize that we can't always put things 10 feet back. So one of the things that we added to this based on a discussion with Avista recently is they are going to start looking at some other ways to vent their utility vaults downtown. And so I added a note in here about utility vault vents would be another thing that we would consider exempting. We also added a section on placemaking language, and this is just to recognize that we like to have planters and some artwork and decorative fixtures and maybe concrete patterns and street name stamps just to help provide a sense of place on our projects. These are the SMC sections that we are updating, and I do have current drafts up on the webpage right now, but I'll likely be posting new ones at probably towards the end of this week. And then here's the schedule again. And that's really all I had to show you today. Do you have any questions?
Any questions or comments for Inga? All right, not seeing. It was very straightforward. Thank you, Inga, as always. I wanted to go out of order just briefly because Tim Sigler has a funding issue that's going to come up on our agenda at briefing in just a few minutes. I want to make sure we get to that. So, Tim, if you're there and can brief that quickly so we know what it is we might be voting on in a few minutes.
Will do. Thank you very much. Yeah, so we had put out a request through Commerce for some rental assistance funds. So there was $95 million that went out for eviction rent assistance. And there is a formula grant that we had applied for. We didn't expect to get a response as quick as we did, but basically it's a little over $660,000 that would go towards rental assistance for young adults. So we put the application in, they approved it, and they turned the contract quickly, which is great. So just looking at the calendar, the sooner that we can get this out for RFP, the better. So my request would be to suspend the rules to get this on the agenda so a vote can take place to accept these funds. Again, it's a formula, so it wasn't a request by CHHS for a certain amount. It is that is the amount that was allotted to us if we requested it and applied for it. So it's good news. We just want to get it out to the community as soon as we possibly can.
Any questions for Tim? All right. Great. Thanks, Tim. I'm sure someone will bring a motion to suspend the rules and add it to this evening's consent agenda.
Great. Thank you.
And you don't need to, well, it's just going to be at briefing, but you don't need to come, I don't think. So, okay. Next up is the billing system conversion.
Great. Thank you. That's the Utility Information System Project extension?
Yes.
All right. Let me share my screen real quick. So can you see my screen?
Yes.
Great. So this is Brandon Myers. I'm the project manager for the Utility Information System Project, and we also have Corinne Morris on the line to help with any questions, so the Utilities Billing and Collections Manager. And we also have Peggy Lund, the IT Applications Supervisor, to help if we have any more technical questions. So just to provide a little background and history that leads up to this request. The utility billing system it currently bills and collects around a little over 200 million in annual revenue for city utilities. It's water, solid waste, and wastewater. And the current system called C-Star is from the 90s. It's homegrown. It's something that has been developed within the city for a lot of years, which has led to some over-customization, gave us a lot of flexibility, but it also allowed for things to be customized to the extreme. And it lacks some modern features that people expect nowadays. In 2018, an RFP was put out for a new utility billing system, and in 2019, the contract was awarded to Systems and Software for their product called Enquesta. And the project team covers a lot of departments, considering across the utility areas and IT and accounting. So there are about 43 employees that are involved, and around 20 other software systems throughout the city are interfacing or being integrated into this new system. And the project goals are replacing the aged system with the best of class, the new stuff, the leading technologies that are available today that provide some of those enhanced customer features, streamline the workflows, and be able to integrate with other systems that we have throughout the city to try to make things just work better and cleaner and smarter. And some of the enhanced customer features are smart self-service features for customers, mobile app, automated text and email alerts, and access to data for customers to see what their water, sewer, and refuse usages are. And what we ran into is in the spring with the COVID-19 impacts. Everyone's familiar with those. It's impacted everyone, and due to some of the changes that we had to make, there were some direct impacts on milestones and deliverables for the project, and some of those impacts were employee availability. We went from having most people in an office or in City Hall to needing to telecommute and transition from their office spaces to their home, wherever they were telecommuting from, having the technology set up and everything that it took to make that happen. Some employees were not in a position to telecommute, and were also not in a position to work from the office as usual. So there was also some extended time off, with the remaining employees then taking on that increased workload and needing to cover and still try to keep the project stuff going. And we had a project employee that was dedicated to the project full time that was on standby layoff because of all of the changes that were made. As far as the project activity impacts, because we had the limited resources and there were a lot of technology changes going on, we lost some time there. And some of the activities that were taking place, like the process designs, the development of interfaces and integrations and training that we had scheduled, a number of those things were pushed back or slowed down because of the COVID-19 response. Continued impacts that we're still seeing, we're using online meetings and training and everything versus the in-person sessions, which is not ideal. We're making good progress. People are getting up to speed and we're working with this new norm, but it is still somewhat challenging. And just as an example, from the start of the project up through February, the vendor was on site full time for around 2.5 weeks each month in order to really help keep us moving forward. And the details of the contract extension request, we are requesting that we move our go live for the project from November 2020 to April 2021. And there are some financial and project impacts associated with that. Some financial impact, we'll cover that first. the vendor system and software recognizes that the COVID-19 was a no-fault thing, and so for the initial 6-week period that things were really, really slowed down, they're not going to charge us for that time. They're going to go ahead and extend that free of charge. The original project budget was around $3.3 million. The project extension cost for the additional 5 months is about $320,000. So the total project cost with the extension is about $3.7 million, so around a 9% increase in cost for the project. And how this will impact the project is it will allow time to deal with the issues that we've run into so far because of the COVID-19 response, and also gives us a little bit of buffer to deal with any future unknown risks that may come around with COVID-19 or anything else, really. It also allows us to get past the end-of-year processes that typically cause some resource capacity challenges at the end and the beginning of every year. And it gives us time to make sure that we do this right, so that we have a successful launch versus trying to rush this deadline with all of the impacts that we've had so far, and potentially missing or skipping or skimping on things that we need to make sure that we're able to release this day one, and that our customers will be happy, have their needs met, and it will work as planned. And that is the high level on that. Any questions?
Any questions or comments from council?
This is Karen.
Go ahead, Karen.
Brandon, just a quick question, and I don't know if I'm even asking the right question, so bear with me. How does this connect to the 311 system? Is there going to be does there need to be interactive communication between the two?
Yes, definitely. This, I mentioned earlier that there are about 20 systems that are interfacing with this new utility billing system, and 311 is one of those.
Okay.
That is something that yeah.
Okay.
Great. Other questions or comments for Brandon? All right. Thank you, Brandon. We're really looking forward to getting there with this, and I think you're doing a great job, even with the obstacles and challenges from COVID. So thanks for this, and we'll look forward to hearing more in a few months.
Thank you.
I thought I would just skip to the UHelp ordinance extension real quick for Marlene. We've got about 15 minutes left to do a couple things, but I thought that would be a quick one.
Well, good afternoon, Council. So, I just wanted to say that our goal here is we had to adopt an ordinance back in March that allowed for a little additional flexibility for customers who were seeking assistance through UHelp as a result of the pandemic. That ordinance will expire in September. We also had a SNAP on as with a contract to do the processing for UHelp. And that contract would have expired this month. I'm in the process of extending that contract until March 31st, and then it makes sense to extend the flexibility through UHelp through that same time period. So this is just an extension of an action that you took back in March. We just didn't anticipate the length of the pandemic when we had you do that. And just for your information, through the 18th of August, we have distributed more than $67,000 to customers who are facing financial hardship.
And how much money do we have left in the fund that you guys raised?
Well, we raised about $76,000 through the fundraising campaign, but we also had a starting balance to that, and we were able to help SNAP get a grant for $7,500, and we did get a little bit of money from Innovia, and we continue to get money from our customers on a donation basis that we match dollar for dollar from the city utilities. So in our fund is still significant, sufficient funds for the time being, but we may have to go back for another round of donations.
All right. Any questions? Other questions for Marlene? All right. Great. We'll look forward to seeing that on our agenda coming up. All right, Scott, rate setting process.
I think, Brandon, we just had this as a placeholder in the event that we weren't able to get through everything at the session, so I'll yield time back.
Okay, even better. Thanks. Then Tim Zamblin, there was a few questions about the Yellowstone Pipeline franchise agreement, so we gave you some time today for council members to ask questions or raise concerns. I don't think there was anything more you were supposed to report back yet today. You'll probably get questioned here in a minute. I see Councilmember Kinnear. Okay. Yes.
Hi, Tim. Thanks.
Hi.
I'd like to know, I'm really uncomfortable with this agreement. I'd like to know if council doesn't approve this, what are next steps? I mean, what do we have as options if we're not comfortable with this agreement? Can we ask for more money? Can we ask for them to pay more insurance? What are our options?
Thank you, Councilman. One of the things that I did submit an updated briefing paper on the Yellowstone pipeline, and one of the points that I really have to drive home is that pipelines are highly regulated by the Federal Pipeline and Hazardous Materials Safety Administration, along with the Washington State Pipeline Safety Commission under the Washington Utility and Transportation Committee. So one of the things that you really have to focus on is that we're really limited in our requirements that we can be placed on pipelines. In my previous briefings, I told you part of the delay that took place in getting this franchise to where it is today was based on the city of Seattle trying to implement additional regulations on Olympic Pipeline. And that case went all the way up to the Ninth Circuit, and the ruling was the Pipeline Safety Act expressly preempts local pipeline safety regulations. So in a long answer is we are limited on what we can ask these pipeline operators to do because it's federally preempted, as I've set forth in the briefing paper, along with the independent legal review really sets forth that the draft that's before this council has done a great job in protecting the city's rights and making sure there's a significant or a sufficient emergency response plan. And this franchise also addresses if there is an issue, we can work with the company on their response plans to a spill, such as practicing with their drills, which they do on an annual basis. So if we don't do anything, we would be stuck with our previous franchise that had expired, which really does not provide for an emergency response plan. It doesn't have $100 million guaranteed liability, and we would still be at our same franchise fee of $200. So there's, if we don't adopt it, then we're kind of giving up on some great benefits that we've negotiated. The $100 million insurance, I will say, it came out of the Model Pipeline Act, which MRSC worked with the state commission on putting it together after the 1990 99 Olympic pipeline issue in Bellingham. So that's kind of a global response to your question.
Tim, I have a quick follow-up.
Can I follow up?
Oh.
I understand there are lots of safeguards in place, and yet accidents are still happening. I'm concerned that this is so close to a major well in District 1. It's also in a district that is fairly low income, and if something happens, our aquifer serves over 500,000 people, and we don't know the extent of what a leak would do to, or how far it would go, how much it would contaminate. And I'm looking at this $100 million thinking that isn't not going to repair damages for what could happen. And their parent company is extremely wealthy. They are protected in a number of ways, the way that they're structured. And I get that they're not paying their fair share right now. The rent or the franchise fee, and then the right-of-way fee, sorry, and then just what they're asking for in terms of what they would take from what they would pay out. There's so many disparities in it, and I don't even know. I get what you're telling us, but I'm just struck by how we just have to take this and not say there has to be some other mechanism by which we could say, let's go back to the drawing board. So, and Brian, I know you're going to chime in, so feel free.
My quick follow-up, Tim, was if recognizing there's only certain things we have the ability to negotiate with them, but if we're at an impasse, is there a procedure to go to court and ask the judge for them to pay more or to put more security? What happens when there's an impasse in the negotiations?
As I mentioned earlier, yes, if you try to ask to do stuff that puts additional local requirements on them, they could go to federal court, like I just mentioned in the Olympic pipeline versus the city of Seattle, which ruled against the city saying, no, you went beyond what you're allowed to do. Right. I think if there was an impasse, the best thing you could do is probably go on the federal level to talk to the federal administration.
I'm talking about an impasse within the city's authority. So yeah, the city can't impose safety, but in terms of financial security for future damages or the franchise fee amount, those are within the city's parameters. I'm just not. I know you do the franchise work for the city. I don't know anything about it, but if we can't reach an agreement, if it's within the spectrum of what we do have a say on, does it go to court or not? Or are we just stuck with the last agreement that we agreed to?
I believe we'd be stuck with the last agreement we had. Again, this agreement has taken as long as it has because of Seattle trying to, ask for things that are above. I'm not sure what you are asking for. I know you participated in a telephone call with the General Counsel of Phillips 66. While he can't put it on paper, he would say that being the operator, they would come in and take care of any spill or response needed in the Spokane area. And I think another important thing for the council to understand is the pipeline that is actually in the city is not great. It comes in through Idaho, over the aquifer, through the city of the valley, and it goes up through the county. So there's there's a lot of issue with hopefully getting this franchise taken care of. So the other jurisdictions do not have current franchises. So this is an important stepping stone in making sure not only the city is protected to get clean drinking water to the other jurisdictions that we provide water to, but to protect the entire area.
Councilmember Cathcart.
Yeah, thanks, Tim. I just wanted to point out, I've seen a few emails come through from folks saying, don't build the pipeline. And we're not talking about building a pipeline. This is a pipeline that already exists and has existed for quite some time. And it's just renegotiating the terms of the deal in which the pipeline exists. And I'm curious, Tim, could you say what was the carrot, I guess, used to get them to agree to up the annual fees and kind of the amount of money in terms of an incident should it occur? And is there any, I guess, additional wiggle room there with whatever you use to get where we were now to maybe get a little further if that's sort of the will of the council?
How we reach the fee is like looking at other jurisdictions that have big populations, such as Seattle, Bellevue, Renton, Bellingham, who all came onto this $25,000 amount. And it took some negotiation to get the $25,000 a year put in place. And another important thing about the $25,000 is that after 5 years, that can be adjusted upward. So there is a mechanism for it increasing.
But I guess my question though is why would they, if with the deal that was there before, and since if we vote no, the previous deal remains in place. It's not like the pipeline goes away. It will remain and they use it. So I guess my question is, what was their incentive to agree to these much better terms for us than before?
Because we showed them that other jurisdictions in the state of Washington had agreed to the $25,000 a year franchise fee.
That was it. Okay.
Yeah.
All right.
We are out of time from our TV production parameters to get ready for our 3:30 briefing. So I'm going to have to, I'm not sure that we're done with this conversation. Thank you, Tim, for coming, but I have to finish it so that they can adjust some things. We have a few more weeks to talk about this because we're on a 4-week notice period for the franchise, and we can talk offline as well. Thanks, everyone, for participating in a great meeting. Lots of information. I look forward to seeing at least the council members in a few minutes. We're adjourned.
Thank you.